cancer is the most common cancer in women in general. And your risk increases as you get older. In the US, the stats are 1 in 8 women have a lifetime risk of getting breast cancer. And that's really quite scary. That's very significant. So if you think of the 8 women that are maybe in your team, or maybe 8 women in your family, one out of those 8 women are likely to get breast cancer. So we need to be doing regular screenings. And it starts off with a self-breast exam. So 90%, or actually more than 90%, I think the figures are like 95% of breast lumps are picked up by patients themselves, not picked up by doctors, so GPs or gynae. You are the most important person in the screening process. So your self-breast exam should be done monthly. If you do it every month, and if you do it at the same time every month, you will become familiar with how your breasts feel. When you're young and before you've had kids, your breasts will be very, very lumpy, and because they're very glandular. Do it in the first week after your period every month. You'll become familiar with what your breast feels like, and then you'll be more likely to pick up something that's abnormal. So I like to tell my patients the first week after their period, either in the shower or lying in the bed, you put your arm up, and with your other hand, you feel the breast. You start in the middle, you work your way out, work it back up, work it out, work it back in, using the soft parts of your fingers. And if you feel something that feels like a lump or feels a little bit unusual, take it between your fingers and try and move it. It's a good sign if it's mobile. It's less likely to be breast cancer, because breast cancer is sticky and it likes to stick to the breast wall and to the chest. And then once you've gone all the way around, make sure that you feel underneath the nipple, feel up and into the armpits, and then look for asymmetry. So look at the skin.
And if you're not sure, please chat to your GP, because we will assist you and show you how to do a proper exam.
It's a good time at your pap smear to ask the GP just to show you how to do a breast exam. But the other important thing to note is that it can take up to 3 years for a breast lump to become palpable, and that's really quite advanced. So we want you to pick it up sooner, and the easiest way to do that is with imaging. So there's 2 different ways that we image your breast. The one is the ultrasound, and the one is the mammogram. Before you've had kids and under the age of 40, because your breasts are still quite dense and still quite glandular, it's difficult for the mammogram to give you a good view, and so we prefer to do an ultrasound. And ultrasounds are nice because they're not exposing you to radiation, so they actually don't have any risk. And you do it at any radiology department. It's a little probe, they put it onto the breast, and they are able to have a look and see if there are any lumps and bumps. So if you have any concerns, and especially if you've got a family history, be proactive, do the screening early. Medical aids in South Africa, unfortunately, only start paying for mammograms from the age of 40. In the US, they do them from 35. So from 40 at least, please start doing your annual mammogram. It's just an x-ray basically of the breast, and it's looking for microcalcification. So it looks for like little white dots in the breast that might look suspicious and might alert you to something underlying. And I've actually just turned 40, so I had my first mammogram a month ago. And it was strange to be a patient, and I was quite nervous. But once you've done it once, you realize that actually you don't have anything to fear. And they just put your breast between 2 plates, and they do it from the top and they do it from the side, and it's over very quickly. What I find in my practice is a lot of women are really worried about their oral contraceptive pill or their hormone replacement therapy and the risk that poses from a breast cancer perspective. But I read something last night that I thought was actually quite very significant, is that the increase in the risk of breast cancer from taking hormones is the same as the increase from being overweight. So if you are worried about hormones and you're worried about HRT and your breast cancer risk, you should also be worried about your weight, because your weight it increases risk just as much as taking hormones does. The golden years. And that's when colonoscopies and bone density scans become more important. So the colonoscopy doesn't only need to be done in theatre. The colonoscopy can also be done as an outpatient, so it can be a day procedure as well. And I also tell patients that you always fear things that you don't know. So the first time you're going to go and do it, you will be anxious, but you will also realize that it's quite a non-event. So you'll also realize that you don't need to be fearful. You're given a pre-med, and you ask the data during the procedure, and you won't remember what's happened. So If you've got a family history of colon cancer, then you actually need to do the colonoscopy 10 years before the age of diagnosis of that family member.
Yes. So over the age of 50, we also want to check bone density because we want to prevent you developing brittle bones as you get older.
So when we do that first bone density scan, that is actually our reference point. So that is your baseline. And then depending on what that looks like, you might need to do it again at 55 or again at 60. And we will then compare the two bone densities. And why it's so important is because if you develop brittle bones later in life, then your risk of fracturing or breaking bones is much greater.
So they've actually proven that as an older individual, falling is as traumatic as retiring or losing a losing a loved one. And falling can be a significant part of aging you. And if you're going to fall and break something, that increases or decreases your life expectancy significantly. But if you're going to have strong bones, it's not going to affect that.
So how do you make sure that you've got strong bones? I think that's an important thing as well, because that you can start doing from early on.
Yeah.
So weight-bearing exercise. So every time that you do an exercise where you jar or you hit the ground and gravity is in play, it causes little shocks that go through the bones. And those little shocks stimulate the bone to what we call remodel. So break down and be rebuilt. And every time it gets broken down and rebuilt, it gets stronger. So it's very important that you are doing weight-bearing exercise. So doing walking, doing running, cycling and swimming are excellent forms of exercise for other reasons, for your heart and for your mental state. But weight-bearing exercise is very important for your bones. Even going to the gym and lifting weights helps a lot as well. So you can start doing that now.
They've actually proven that high-intensity interval training is the best form to improve bone remodeling going forward.
If you're taking a calcium supplement, you need to discuss it with your doctor because there are risks associated with taking calcium supplements. So it's not for everybody. It can increase your risk of stones, so kidney stones, and it can also deposit itself in your arteries. If you don't have estrogen, the right levels of estrogen or high enough levels of estrogen, you won't deposit it into the right places. So I think calcium is quite important to discuss with your doctor and to make a decision with your doctor regarding whether or not you need to be replacing. It's not something that I really recommend people just taking the shelf at disc and taking ad hoc. Okay, so in summary, what are your take-home messages? So I think the really important thing is that there's so much in the world that is out of our control, but what is in our control is our human bodies and optimizing our own health. So how do we do that? Number one is my favorite, the microbiome. Please read and educate yourself on the microbiome and look after your bugs. Number two,
inflammation.
Yes, so bringing your inflammatory levels down, chat to your doctor. Please stay away from processed foods, stay away from pesticides and poisons, make sure your weight is under control and manage your stress because those are all very important from an inflammatory perspective and will determine your response to things like the COVID vaccine or to the COVID virus.
But these things will also affect your hormones and it will cause imbalances in your hormones.
Okay. Number four.
Eating a rainbow, and that's very important because the more diversity you have in what you're taking in, the better your protection and supplementation will be in micronutrients.
Perfect. And then number five is being mindful. So is your mental resilience.